Daily bathing may harm the skin of the elderly. Daily bathing has long been an essential routine for many people. Keeping clean helps them feel refreshed, fragrant, and more confident. However, not everyone knows that bathing too frequently, especially with hot water, can be harmful to the skin, particularly for the elderly. Frequent hot water baths strip away the skin's natural oils. The skin has a natural oil layer that helps retain moisture and protect against environmental damage. Frequent exposure to hot water can wash away this oil layer, making the skin dry and prone to irritation. This issue is especially concerning for older adults, as the body's ability to produce natural oils significantly decreases with age. Additionally, hot water can expand hair follicles and disrupt the skin's protective barrier, causing faster moisture loss. This leads to peeling, roughness, and even dermatitis if not properly cared for. Aging skin becomes thinner and more vulnerable. Over time, human skin becomes more delicate due to the decline in collagen and elastin, two essential components that maintain skin elasticity and firmness. As the skin thins, it also becomes more sensitive and prone to scratches, wounds, and deeper damage compared to when it was younger. Frequent hot water baths not only dry out the skin but also weaken its natural protective barrier, making elderly skin more susceptible to irritation and infections. Furthermore, people with sensitive skin or skin conditions such as eczema, psoriasis, or atopic dermatitis may experience worsened symptoms if exposed to excessive hot water. How to protect aging skin? To maintain healthy skin in old age, seniors should adjust their bathing habits as follows. Reduce frequency. If not necessary, avoid daily bathing. Instead, limit showers to about 2 to 3 times per week, especially in cold weather. On non-bathing days, use a warm washcloth to clean the body. Avoid overly hot water. The ideal water temperature should be moderate, around 37 to 40 degrees Celsius, 98 to 104 degrees Fahrenheit, to minimize moisture loss. Use gentle cleansers. Choose body washes and soaps with a balanced pH and moisturizing ingredients like aloe vera, glycerin, and coconut oil to keep the skin soft. Moisturize immediately after bathing. After showering, gently pat the skin dry and apply a moisturizer while the skin is still slightly damp to lock in moisture and prevent dryness. Stay hydrated and eat a healthy diet. Drinking enough water and consuming vitamin-rich foods such as fruits, vegetables, and fatty fish helps maintain skin hydration and promotes skin recovery from within. Bathing is essential for personal hygiene, but excessive bathing, especially with hot water, can harm the skin, especially for older adults. Understanding the effects of hot showers and adjusting bathing routines appropriately can help protect the skin, keeping the body healthy and comfortable. Hot water and strong soap, the silent enemies of your skin. Every day, many of us habitually wash our hands or bathe with hot water and use strong alkaline soap, believing that this helps cleanse the body more effectively. However, few realize that these habits can damage the skin, especially for older adults, whose skin becomes thinner and more sensitive over time. Hot water, the destroyer of the skin's protective barrier. The skin is naturally protected by a lipid layer that helps retain moisture and block harmful environmental factors. When exposed to hot water, this lipid layer dissolves, weakening the skin's barrier. As a result, the skin becomes dry, cracked, and loses its ability to retain natural moisture. For older adults, the skin already produces less oil compared to younger years. When this protective layer is stripped away by hot water, the skin becomes even more vulnerable to dryness and external irritants. This can lead to frequent issues such as flaking, cracking, and even dermatitis. Alkaline soap, disrupting pH balance and increasing infection risk. In addition to hot water, using strong alkaline soaps can further harm the skin. Naturally, the skin has a slightly acidic pH level, around 4.5 to 5.5, which helps maintain a balance of beneficial bacteria and prevents harmful bacteria from invading. However, using high alkaline soap can disrupt this pH balance, stripping away the skin's natural defenses. As a result, the skin becomes irritated, dry, and more susceptible to infections. For older adults whose skin is already weaker and slower to heal, This increases the risk of severe skin conditions. How to protect your skin. Reduce water temperature when washing hands or bathing. Use lukewarm water, around 35 to 37 degrees Celsius, to cleanse the skin without stripping away natural oils. Choose gentle soap. Opt for soaps with a neutral pH or those containing moisturizing ingredients like glycerin and aloe vera to help maintain skin hydration. Moisturize regularly. Apply moisturizer after washing or bathing to help restore and protect the skin. By making small daily habit changes, we can protect our skin better, especially as we age. Take care of your skin to maintain long-term comfort and health. Frequent bathing can harm older adult skin. Bathing is an essential hygiene practice that helps us feel clean and refreshed. However, for older adults, bathing too frequently can pose risks to skin health and even increase the likelihood of infections. Natural oils, a vital protective barrier. Human skin produces natural oils that help retain moisture and create a protective shield against bacteria, fungi, and environmental aggressors. Frequent bathing, especially with hot water and strong soaps, washes away these oils, leaving the skin dry, irritated, and vulnerable. This is particularly concerning for older adults, whose skin is naturally thinner and more sensitive than that of younger individuals. Excessive bathing, the hidden risk of skin infections. One of the most concerning drawbacks of excessive bathing is the increased risk of skin infections. When the skin's natural protective barrier is compromised, bacteria can easily penetrate, leading to conditions such as cellulitis, a dangerous skin infection that can cause redness, pain, and even spread to deeper layers. Not only that, frequent bathing also strips away beneficial bacteria on the skin surface, disrupting the balance of the skin's microbiome. This makes the skin more vulnerable to attacks from harmful bacteria. How often should seniors bathe? According to dermatologists, older adults do not necessarily need to bathe daily, like younger individuals. A frequency of 2 to 3 times per week is generally sufficient, depending on physical activity levels and weather conditions. On non-bathing days, using a warm towel to clean the body, especially sweat-prone areas like the underarms, groin, and feet, can help maintain hygiene. Additionally, when bathing, seniors should keep in mind the following tips to protect their skin. Use lukewarm water instead of hot water to prevent dehydration. Choose mild, non-irritating soaps without harsh chemicals. Apply moisturizer immediately after bathing to lock in hydration. Avoid excessive scrubbing, as it can cause deeper skin damage. Bathing is essential, but excessive bathing can be harmful, especially for older adults. Maintaining a balanced bathing routine along with proper skincare can help keep the skin healthy, reduce the risk of infections, and prevent unwanted complications. Overwashing the face, a hidden risk for aging skin. Cleansing the face is an integral part of a skincare routine. However, for older adults, this habit should be adjusted to prevent damage to aging skin, which becomes thinner and more sensitive over time. Aging skin, fragile and slower to heal. As we age, skin loses its elasticity due to the decline of collagen and elastin production. This makes it thinner and less resilient, causing wounds, even minor scratches or abrasions, to take longer to heal. If not properly cared for, these small injuries can lead to more serious skin issues. Frequent face washing, particularly with hot water or harsh cleansers, can strip away the skin's natural oils that serve as a protective barrier. Once this barrier is weakened, the skin becomes dry, cracked, and prone to damage. For older adults, even a small tear in the skin can become a significant concern, as the skin's ability to regenerate has significantly slowed down. By adopting gentler cleansing methods, seniors can better preserve their skin's health, maintaining moisture and preventing unnecessary irritation or damage. The hidden risks of small skin tears. One of the most concerning risks of skin tears is the increased chance of infection. When the protective skin barrier is damaged, bacteria can easily enter and cause inflammation. For older adults with weakened immune systems, this risk is even higher. More seriously, if left untreated, an infection can spread and lead to life-threatening conditions such as sepsis, where bacteria enter the bloodstream. This is particularly dangerous for individuals with underlying health conditions like diabetes, cardiovascular disease, or immune deficiencies. Proper skincare for aging skin. To protect aging skin and prevent unnecessary damage, seniors should follow these essential skincare tips. Limit face washing. Wash your face only once or twice a day, using lukewarm water, not hot, to prevent excessive dryness. Use gentle cleansers. Choose products that are alcohol-free and do not contain harsh foaming agents to preserve the skin's natural oils. Moisturize thoroughly. Apply a suitable moisturizer immediately after washing to maintain hydration and strengthen the skin barrier. Avoid harsh rubbing. When drying your face, use a soft towel and pat gently instead of rubbing to prevent skin damage. Protect against bacteria. If there are any cuts or tears, clean the area properly and apply antiseptic to prevent infections. By maintaining a proper skincare routine, older adults can effectively protect their skin, minimize unnecessary damage, and keep their skin healthy and resilient. Why is the bathroom so dangerous? The bathroom has several risk factors that increase the chance of falling. Slippery floors. Water or soap residue makes the surface slick, reducing foot grip. Loss of balance occurs when stepping in or out of the bathtub, standing up after bending down, or walking on wet floors. Fatigue from standing too long. For seniors, prolonged standing can cause tired legs, loss of strength, and slower reflexes. Warning: consequences of a fall. A bathroom fall can lead to serious, life-changing injuries, including bone fractures, especially hip, wrist, or femur fractures, which reduce mobility and often require long hospital stays. Pain and bruises. Hard bathroom surfaces increase the risk of severe pain and long-lasting bruising. Loss of independence. After a severe fall, many older adults struggle with self-care and need assistance from family or caregivers. How to prevent falls in the bathroom. Use non-slip mats. Place high-grip mats inside and outside the shower to prevent slipping. Install grab bars. Provides a sturdy support point when moving around the bathroom. Use a shower chair. Helps reduce the risk of losing balance while showering. Keep the bathroom well lit. Ensure there is enough light to avoid tripping. Move carefully. Walk slowly. Maintain a stable posture and avoid sudden movements in the bathroom. The bathroom poses significant risks for older adults, especially fall-related injuries. However, with a few simple precautions, we can greatly reduce these dangers, helping seniors stay safe and independent. Always prioritize bathroom safety to prevent unnecessary accidents. Bathing less can improve safety and hygiene. When it comes to personal care, many people believe that daily showers are essential for hygiene and health. However, experts suggest that bathing too frequently, especially for seniors, can lead to unwanted health issues. In fact, showering 1 to 2 times a week, combined with cleaning key areas like the armpits, groin, and face, can maintain cleanliness while providing significant health benefits. Reduces the risk of falls. One of the biggest dangers for seniors is falling in the bathroom. Slippery floors, soapy water, and balance issues can lead to serious accidents. By bathing less often, exposure to these hazards is significantly reduced, lowering the risk of falls. Additionally, less frequent bathing helps conserve energy. For many older adults, each shower can be physically demanding. Reducing the number of showers per week can ease strain on the body, preventing unnecessary fatigue. Protect skin from dryness and irritation. As people age, their skin becomes thinner, more sensitive, and prone to moisture loss. Frequent bathing, especially with hot water and strong soaps, can strip away the skin's natural oils, leading to dryness, irritation, and even cracking. When the skin becomes too dry, the risk of infections and inflammation increases. Instead of frequent showers, using a damp cloth to clean sweat-prone areas like armpits, groin, and face can maintain hygiene without drying out the skin. Additionally, applying moisturizer after bathing can help keep the skin hydrated and healthy. Maintains the skin's natural bacterial balance. The human body has a natural microbiome that helps protect the skin from harmful bacteria. Overwashing, especially with antibacterial soaps, can disrupt this balance, making the skin more vulnerable to infections and irritation. A smarter approach to hygiene. Bathing less often doesn't mean poor hygiene. In fact, showering 1 to 2 times per week, combined with daily targeted cleansing, can help seniors stay clean, protect their skin, reduce fall risks, and conserve energy. The key is to choose a hygiene routine that suits individual health conditions and needs, ensuring a safe and comfortable lifestyle. The skin's natural microbiome, an essential protective layer. Our skin is not just an outer shield, it is a living ecosystem teeming with millions of beneficial bacteria. These microorganisms form the skin microbiome, playing a crucial role in maintaining skin health and protecting the body from harmful environmental factors. Beneficial bacteria, the skin's defenders. Every day, our body produces sweat and natural oils to keep the skin hydrated and balanced. In this process, beneficial bacteria break down sweat and sebum while preventing the overgrowth of harmful bacteria. Additionally, the microbiome helps maintain the skin's natural pH, boosts immune function, and reduces the risk of infections. Without these protective bacteria, the skin becomes more prone to irritation, dermatitis, and bacterial infections. The risks of overwashing. Many people tend to wash their face and shower too frequently using strong soaps or antibacterial products. However, excessive cleansing can strip away beneficial bacteria, disrupting the skin's natural barrier. An imbalanced microbiome can lead to dry, flaky skin, increased breakouts or redness, heightened sensitivity and irritation. How to maintain a healthy skin microbiome. To protect the beneficial bacteria on your skin, consider these practices. Avoid excessive washing. Once a day is sufficient unless your skin is heavily soiled or sweaty. Use gentle cleansers. Avoid harsh soaps that strip away natural oils. Limit antibacterial products. Use only when necessary. Maintain a healthy diet. Consume probiotic-rich foods like yogurt and fermented vegetables to support microbial balance from within. Keep skin moisturized. Apply mild, fragrance-free moisturizers to preserve the skin's natural barrier. The skin's microbiome is essential for maintaining smooth, resilient, and irritation-free skin. Instead of over-cleansing, allow your skin to retain its natural balance for optimal health. Alternative hygiene practices for seniors, gentle and safe methods. As we age, personal hygiene becomes more than just cleanliness. It directly affects health and safety. Older adults often have thinner, more sensitive skin, making them more vulnerable to irritation and damage from excessive washing. Instead of frequent showers or baths, alternative hygiene practices, such as spot cleaning, can be a safe and effective solution. The benefits of spot cleaning. Spot cleaning involves using a damp washcloth to cleanse key areas, such as the face, neck, underarms, private areas, and limbs. This method removes dirt, sweat, and bacteria while preserving the skin's natural protective oils. For seniors who experience mobility issues or have delicate skin, spot cleaning is an excellent way to maintain hygiene without the risks associated with daily bathing. Tips for effective spot cleaning. Use a soft, non-abrasive cloth to prevent irritation. Opt for warm water or a diluted mild cleansing solution. Gently wipe from top to bottom to avoid spreading bacteria. Apply a light moisturizer after cleaning to keep skin hydrated. By adopting these alternative hygiene methods, seniors can maintain cleanliness, protect their skin, and reduce the risks associated with frequent bathing. Enhancing bathroom safety. In addition to adopting alternative hygiene methods, ensuring bathroom safety is crucial for older adults. Slippery bathroom surfaces can lead to serious injuries, potentially impacting long-term health. Measures to improve bathroom safety. Install grab bars. These provide support when stepping in and out of the bathtub and help with balance while sitting or standing. Use non-slip mats. These mats reduce the risk of falls, especially on wet bathroom floors. Shower chairs. If standing for long periods is difficult, a shower chair can make bathing safer and more comfortable. Ensure proper lighting. Poor lighting can make it harder for seniors to see obstacles, increasing the risk of tripping. Conclusion. Personal hygiene is a vital aspect of senior care. Spot cleaning offers an effective way to maintain cleanliness without causing skin irritation. At the same time, implementing safety measures, such as grab bars, non-slip mats, and adequate lighting can help older adults live healthier and more independently.